The American Health Journal, bringing you the latest information on medicine, psychology, diagnosis, treatment, and prevention. Major medical advances are made each week, and each week the American Health Journal keeps you up to date.
Hello and welcome to this edition of the American Health Journal. I'm your host, Roger Cooper. Today we have a series of reports that offer insights into various specialties of medicine. First up, we'll show you a new minimally invasive surgical procedure that takes less than 30 minutes and restores vision to what it was when you were younger. Now on the American Health Journal. Presbyopia is an ocular condition that occurs with age, increases farsightedness, and affects over 100 million people worldwide. Dr. Brian Boxer-Wackler of the Boxer-Wackler Vision Institute illustrates how minimally invasive surgical implants combined with computer software and eye exercises could mean effective means of treatment.
We have a revolutionary new technique called Revital Vision. So Revital Vision has done research, many years of research, to find that there's a way to stimulate specifically the visual part of your brain, so that if you're working that part of the brain and making it work better, you actually can see better. So that's really revolutionary, and it's not eye exercises like looking up and down and side to side. It's not that. These are specific things that you have to look at on a computer screen that are testing your vision, pushing it, sort of like working out at the gym, but doing that for your vision. And after this program, it's been shown that it can significantly improve people's ability to read. And it's the modern day way of helping improve your reading vision without surgery. Revital Vision is a program that you do at home. So you have to have an eye exam just to establish the baseline measurements on your eyes. But then the program is done on your home computer, and what you'll be able to do is spend about 20 minutes for each of the sessions, and you complete the program in 20 sessions. And so what we find is that it's a permanent, long-term type change, and that you don't lose the effect. The procedure does work sort of ideally in people in their 40s, but even people in their 50s and 60s can have a benefit too. When you think about how much you've spent over the years with a pair of glasses, here you had to buy another pair, you sat on a pair, broke a pair, I mean all these glasses add up. So the Revital Vision program, which can be obtained from our office, will pay for itself easily when you consider one or two pairs of those fancy reading glasses you get. For those with more advanced presbyopia, we have a surgical procedure that's currently in the last phase of FDA study, and it involves placing 4 tiny little implants around the white of the eye under the surface. And the way those implants work is they pull back on the muscle that's inside the eye to help it establish tension so it can focus and people can see again up close. The scleral spacing procedure takes about 30 minutes to do. It's done on an outpatient basis. We use really good numbing drops so people are comfortable. And it takes a few weeks for things to recover. The eye's going to be a little bit red while they're healing. But people usually within the first week can already start appreciating that they can see better up close, and sometimes even by the very next day. Patients have been very happy with the procedure because where they used to have reading glasses strategically placed in the car, at home, at the desk, by their TV, in the kitchen, and now to not need to rely on them the way that they used to in the past is very liberating. So people are really excited about the results.
The doctor talked about how the combination of these two treatments can restore vision permanently.
These treatments are going to address the problem that is age-old, which is can't read anymore. People over their 40s, some point, arms aren't long enough. What do? Reach for the store reading glasses. So these treatments really help address that condition, the inability to read, which is technically called presbyopia. Part of my role in the field is to take things that have been very painful, long recoveries, and innovate so that it's easier for patients, easier to recover, quicker recovery. So that's where I see the big advancements continuing to occur, is that things occurring in recoveries being faster and faster and easier for patients.
You're watching the award-winning American Health Journal.